Red yeast rice is a natural source of lovastatin. It can lower cholesterol and decrease fat buildup. Red yeast rice is produced when a mold called Monocolons colonizes and ferments rice. This mold turns the rice dark red and it produces a medicinal compound called Monocolin K. Red yeast rice has been a part of traditional Chinese medicine for over 1,000 years. Today, it's sold as a health food and a supplement across the world. Red yeast rice can be brewed into sake, vinegar, wine, and food pickling. In many East Asian countries, it's also used as a red food coloring. The red yeast rice can decrease cholesterol, lower blood pressure, fight cancer, improve metabolic syndrome, prevent complications of obesity, reduce inflammation, and improve bone health. Red yeast rice contains on average 73% starch, 0.8% fibre, and 5.8% protein by weight. Its health effect is caused by the chemical Monocolin K, the natural form of the cholesterol-lowering drug lovastatin. Monocolin K is chemically indistinguishable from lovastatin. It's the main active component of the red yeast rice. The FDA regulates lovastatin, so commercial red yeast rice cannot be sold in the US if it has more than a trace amount of Monocolin K. However, many red yeast rice supplements do not have information about the Monocolin K content on the label. Multiple studies suggest that these supplements may contain significant amounts of this compound. It's currently impossible to know how much Monocolin K that a particular red yeast rice supplement contains without testing it in the lab. Monocolons produces several bioactive compounds, and these may be beneficial to our health. The most important are the monocolons and the pigments. The red yeast rice contains at least 13 monocolons and several pigments. Monocolons, a yellow pigment, and rubropuncetin, a red pigment, may be used to boost the effectiveness of cancer treatments. Monocolin K, like lovastatin, binds to the HMG-CoA reductase, and it prevents the production of cholesterol. The red yeast rice doesn't just contain the Monocolin K, and its complete mechanism is more complex than lovastatins. According to some researchers, the other compounds in the red yeast rice may in fact reduce the risk of the side effects like muscle weakness. High cholesterol can be a serious health problem, and it's linked to obesity, insulin resistance, high blood pressure, heart attack, stroke, and diabetes. The most effective way to control the cholesterol levels and to prevent these conditions is to make a healthy diet and lifestyle changes. However, some people are prone to high cholesterol regardless of these choices. The red yeast rice lowers the bad LDL cholesterol and the triglycerides, and it raises the good HDL in the blood. It can also prevent weight gain and maintain normal levels of liver enzymes and leptin. In multiple studies with almost 8,000 participants, people supplementing with the red yeast rice had decreased LDL and total cholesterol, with no damage to the liver or kidney function. Triglycerides, like cholesterol, are a type of fatty compound that's found in the blood. Recent studies have found that the triglycerides are more likely than cholesterol to cause heart disease and stroke. Red yeast rice lowers both the cholesterol and the triglycerides, and it measurably reduces the rate of heart attacks. In nearly 5,000 patients who had already suffered a heart attack, the long-term red yeast rice supplementation lowered the mortality rates by a third, and it cut the likelihood of future heart attacks in half, from 10% to 5%. In combination with coenzyme Q10, the red yeast rice also makes the blood vessels more flexible. Stiff blood vessels, especially arteries, increase the risk of plaque forming in the vessels. These blockages can eventually lead to heart attack, stroke, and other complications. Chinese researchers have extensively studied a red yeast rice extract for its anti-inflammatory effects. In 50 patients with coronary heart disease, 1,200 milligrams of the extract per day produced decreased markers of inflammation and triglycerides. In rats with high cholesterol, the red yeast rice decrease the expression of genes that cause inflammation. The rats that ate the supplement had decreased levels of TNF-alpha and interleukin-6, two compounds that increase inflammation. Monocolons, one of the active components of the red yeast rice, may inhibit a gene called HDAC1. We don't yet fully understand how HDAC1 controls inflammation, but the relationship may be responsible for the anti-inflammatory effect of the red yeast rice. Metabolic syndrome is a collection of conditions including obesity, high blood pressure, high blood sugar, insulin resistance, high levels of triglycerides, and low levels of good cholesterol. People with metabolic syndrome also have increased inflammation and are prone to inflammatory conditions. Red yeast rice can lower cholesterol, blood pressure, and blood sugar. It also has anti-inflammatory and bone strengthening effects. High cholesterol and triglycerides can cause serious kidney damage if left untreated. Through its effect on these fats, the red yeast rice protected the kidneys from injury in a rat study. The effect of the red yeast rice on healthy kidneys is currently unknown. Furthermore, some red yeast rice may be contaminated with citrulline, and this can cause kidney damage, so it's not recommended to use red yeast rice as a supplement for kidney health. In one rat study, red yeast rice reduced the bone loss in the rats with osteoporosis. Animals who were given the red yeast rice supplement had higher bone mineral density and healthier bone cells than those without the supplement. A study of white rabbits demonstrated a similar effect. In this study, however, the researchers added a red yeast rice extract to grafts and applied these grafts to the rabbit's skull. The grafts that included the red yeast rice showed improved bone growth when compared to grafts without the extract. Red yeast rice may increase the expression of BMP2 gene. This is important for healing broken bones. Monocolons, the yellow pigment in the red yeast rice, can cause the death of prostate cancer by inhibiting the mTOR and by increasing AMPK. Through the same pathway, this can make cancer cells more sensitive to radiation and enhance the effectiveness of radiation therapies. Another pair of compounds in the red yeast rice, rubopunctin and monocolin L, are of interest to cancer researchers. The rubopunctin can block telomerase, an enzyme that allows cancers to metastasize and move to different parts of the body. Meanwhile, the monocolin L seems to increase the rate of apoptosis or cell death in the tumour. Some research suggests that combining red yeast rice with other supplements can further improve its benefits and prevent the adverse side effects. Red yeast rice, like lovastatin, decreases levels of a compound called coenzyme Q10. The CoQ10 is important for maintaining muscle and strength. This is why the most common side effect of statins is muscle disease. According to some practitioners, supplementing with coenzyme Q10 along with the red yeast rice can reduce the incidence of these side effects. Healthy fats like rice bran oil, rather than coconut or sunflower, may further reduce cholesterol buildup while supplementing with red yeast rice. In one study, rats that ate very high cholesterol diet and supplemented with the red yeast rice. The group that was fed with the rice bran oil had far lower cholesterol and oxidative stress when compared with the rats fed the other oils. Berberine is a compound found in several different medicinal plants. This compound has been a part of Chinese and Indian traditional medicine for thousands of years. Berberine is reported to increase the LDL cholesterol receptors in the liver, thereby reducing the LDL in the blood. In one human study, a combination of berberine and red yeast rice reduced the LDL as much as statin therapy, with a much lower rate of muscle damage. Pregnant women should not use red yeast rice. Lovastatin has been associated with birth defects after exposure in the womb. The data is not conclusive, but most researchers caution against using any statin during pregnancy, and this includes monocolin K. Citrulline is produced by molds and fungi, and it's often found in poorly stored foods. Long-term exposure to citrulline can cause damage to the heart, the liver, the kidneys, and the reproductive system. High-quality red yeast rice does not contain enough citrulline to be dangerous. However, supplement bottles are unlikely to admit the citrulline content. You should use caution and always buy a high-quality supplement to avoid this toxin. Since monocolin K is the same chemical as lovastatin, people taking red yeast rice and lovastatin may have similar side effects. The known side effects of lovastatin include muscle pain and weakness, nausea, heartburn, headache, and memory loss. Muscle problems are among the most commonly reported side effects of all statins, ranging from slight pain to severe muscle breakdown. People with existing muscular conditions like myasthenia gravis should avoid red yeast rice. The monocolin K may worsen their symptoms. Lovastatin is also known to suppress the immune system. This property could be helpful for people with autoimmune disease, but it also makes it more difficult to fight off an infection. Other compounds in the red yeast rice may compensate for some of the negative side effects of the monocolin K. People taking red yeast rice as a supplement usually have fewer side effects than those taking lovastatin. Some people may have a rare allergy to the Monocolons purpureus. In one case, a young and otherwise healthy butcher developed a severe anaphylactic reaction just from handling the red yeast rice as an ingredient for sausage. Few drugs have been specifically tested for interactions with red yeast rice. However, because monocolin K is identical to lovastatin, drugs that interact with lovastatin should not be combined with the red yeast rice. Verapamil treats high blood pressure, angina, and irregular heartbeat. Red yeast rice and lovastatin both increase the availability and the effect of verapamil. If you're taking this for any reason, consult your doctor before supplementing with the red yeast rice. Many drugs have demonstrated interactions with statins. These include erythromycin, clarithromycin, antifungals, antivirals, warfarin, danzanol, immunosuppressants, cimetidine, heart medications. Like some of the drugs mentioned above, grapefruit blocks an enzyme and it prevents statins from being broken down. These statins can then build up dangerously high and cause serious muscle problems. Even a single glass of grapefruit juice with lovastatin could be dangerous. It's recommended to avoid grapefruit if you're supplementing with red yeast rice. Other foods that increase or decrease the CYP3A4 enzyme will also decrease or increase the effect of red yeast rice. Familial hypercholesterolemia. This is a genetic condition and it causes very high levels of bad cholesterol or LDL to build up and remain in the blood, regardless of diet and lifestyle. This condition is underdiagnosed and undertreated. Genetic testing is not offered in all countries. Familial hypercholesterolemia is often treated with statins like lovastatin. The red yeast rice lowers the LDL and it may be especially beneficial to people with this disease. Red yeast rice can be eaten as it is, ground up in a powder or purified into an extract. Some red yeast rice supplements are sold in combination with CoQ10, ostensibly to prevent or to reduce muscle damage. If you choose to supplement with red yeast rice, keep in mind there's currently no way to tell how much monocolin K, citrulline and other compounds are in each supplement without lab testing. Companies are not required to give this information on the label. Clinical studies use a purified extract of the red yeast rice that's guaranteed to contain a certain percentage of monocolons. In one study, 10 milligrams of monocolons per day from a purified extract safely reduced cholesterol and prevented harmful changes to blood vessels. It also lowered hsCRP, a protein that increases during inflammation. In another study, 2.4 grams of red yeast rice per day reduced the cholesterol and the blood triglycerides. The current dose depends on the purity and the form of the supplement. For more information about herbs, supplements, and natural treatments, check out my website.